So let me give the background of this study. Uh, Transplant is really done to prevent relapse or recurrence of the disease. And what has been well known is you can reduce recurrence by giving higher intensity conditioning or myeloablative conditioning. I think the challenge is this is not suitable for older patients. So we took on the challenge of developing a regimen, a myeloablative regimen that can be given to older patients. And that with the idea that the myeloablative regimen will reduce relapse rate and will improve their overall outcomes. So we started, traditionally the conditioning regimen is given over a 4-day period. We said, why do it 4-day period? Why not split it over 2-week or a 3-week period? And so we started giving outpatient doses of Busulfan, about a third of it, say 1 week and 2 weeks prior. And what we saw was, with this, we were able to deliver myeloablative doses of chemotherapy. Now, our initial studies were done with Tacrolimus and Methotrexate as graft-versus-host disease prophylaxis. What we found in early studies was that our day 100 mortality was 4% to 6% in older patients as old as 75. However, 1-year mortality was 20%. And the reason for this difference was we saw a lot of data in one way or the other related to graft-versus-host disease. So seeing very encouraging data on post-transplant cyclophosphamide in preventing graft-versus-host disease and reducing severe acute graft-versus-host disease in haploidentical transplant setting, we said if the same thing could apply to matched donor transplant. So we amended our ongoing trial of a fractionated Busulfan regimen where the first 29 patients got traditional Tacrolimus Methotrexate, but the subsequent patients received post-transplant cyclophosphamide. And so this abstract compares these two particular sequential cohorts. And what we find is that we reduce severe acute graft-versus-host disease, which results in lower non-relapse mortality. In fact, the 1-year non-relapse mortality in PTCy group is 6%, almost unheard of, and patients are as old as 70 included in this trial. So we think with our fractionated Busulfan regimen, addition of post-transplant cyclophosphamide reduces relapse further, and this translates into better overall survival.